7:22 this morning. We are a year into the pandemic, and researchers are just now beginning to learn about the long-term health consequences for patients who have had COVID-19. Those with symptoms that linger long after they're no longer contagious are known as long haulers, and evaluating these patients for further treatment could be complex and will likely involve a lot of data. Joining me live from Southlake, Texas is Dr. Peter Plantis, the physician executive for IndyBase IC1, that is. Dr. Plantis, thank you so much for your time and waking up early for us this morning down in Texas. First of all, what kind of symptoms do long haulers experience?
Well, what they are a continuation of symptoms that are happening during the active period of COVID-19, and they will continue to some degree. Those would be examples of cloudiness in the head, a slowness. There may be some inability for neurological function. Children can be affected, although children are much less frequently affected by a symptomatic case of COVID. They're having up to 10% with some residual of these symptoms afterwards. It's interesting, the loss of taste and smell is one of the most interesting and unique symptoms of a COVID-19. We have been tracing that quite closely and know that people with the loss of taste or smell, that 75% have their taste and smell completely resolved by 6 weeks, but it takes up to 6 months for the majority of the rest to resolve those symptoms. So 5% of people can linger on with long symptoms, and this is something we're just researching now because it's been 12 months since we started getting cases in the United States.
We got a couple of more questions to get to. I want to get to, why do these symptoms matter for other health conditions?
They matter because the interaction of COVID, which we think of like a super flu type of syndrome, will affect different organs. It can affect the heart with arrhythmias. It can affect the brain, as I said, with mental clearness. It can affect the kidneys and other solid organ function. And if you already have underlying organ dysfunction of an illness, this can exaggerate it for a long time.
How does it help a doctor know a patient has had COVID?
Oh, we need to, and that's what in HC1 we're trying to establish. In HC1 is a record for the patient so that they know that their doctor knows when they go, and that they are as such alerted that there's a history of COVID, so that they think about the symptom that might be presenting, let's say 6 months from now, that it could have been from the COVID at the time. And we want to make sure we trace them over time so that we're monitoring whether the symptoms of long haul COVID are resolving, or if they actually complicate the organ function.
All right, Dr. Plantis, we've ran out of time. You're joining us from Southlake, Texas this morning. We really do appreciate your information. We're going to have you back on so we can talk to you more about the long haulers. I appreciate it again. And if you would like more information, just head to fox59.com/links.